You might be surprised to know that calcium isn't the only nutrient that helps keep your bones strong. In fact, some other vitamins and minerals are just as important, if not more so. In this video, let's learn about which vitamins and minerals you must take other than calcium to keep your bones strong and healthy. Number 1. Vitamin D. Keeping your bones strong and healthy requires more than just having a glass of milk. Vitamin D is crucial for strong bones as it helps your body absorb calcium from the foods or drinks you consume. In fact, a deficiency in vitamin D can potentially cause rickets in children and osteomalacia in adults. Rickets often shows up as bone degradation and structural deformities, while osteomalacia shows up in symptoms like bone pain, muscle weakness, height loss, and kyphosis, or curvature of the spine. Vitamin D also helps to regulate the amount of calcium and phosphate in your body, which is important for healthy bones, teeth, and muscles. The recommended daily intake of vitamin D varies across different age groups, with the National Institutes of Health suggesting 400 international units for children aged 0 to 12 months, and at least 600 international units for adults aged between 1 and 70 years. Those aged 71 and older are advised to have 800 international units of vitamin D daily. Several foods rich in vitamin D can help you reach these recommended levels. Fatty fish, like salmon, provides about 526 to 1,000 international units in just a 100-gram serving. Additionally, the yolk of one large egg gives you about 44 international units of vitamin D, and fortified products like milk contain 115 to 130 international units per cup. Number 2. Vitamin K. Vitamin K is another essential nutrient for maintaining strong bones, since it helps in the production of a protein called osteocalcin, which is responsible for binding calcium to the bone matrix. Osteocalcin, in turn, helps to increase bone density and strength. Studies have shown that a higher daily intake of vitamin K reduces the risk of bone fractures and low bone density, a condition called osteopenia. The recommended daily intake of vitamin K varies depending on age, gender, and other factors. According to the National Institutes of Health, the daily recommended intake of vitamin K for adults is 90 micrograms for women and 120 micrograms for men. You can easily take enough vitamin K from green vegetables. Among the top sources are cooked kale, which has 531 micrograms of vitamin K, and cooked mustard greens, which has 415 micrograms. Raw Swiss chard and cooked collard greens provide 398 and 386 micrograms, respectively. Another pretty healthy option is Knowhow, a fermented soybean product, which offers a substantial 80 to 120 micrograms of vitamin K in just a 100-gram serving. It also gives you about 17% of your daily value for calcium and about 14% of the daily value of magnesium, an additional bonus for bone health. While vitamin K is often included in many over-the-counter supplements for bone strength, the amounts are typically less than 75% of the daily recommended value. So it's best if you take vitamin K with your calcium supplements as per the recommended dose from your healthcare expert. Number 3. Magnesium. Studies estimate that up to 30% of adults may not meet their magnesium needs. In fact, studies show that magnesium deficiency can contribute to a 25% increase in the risk of osteoporosis-related fractures, particularly in older adults. Magnesium acts as a cofactor for enzymes involved in the absorption and metabolism of calcium, the backbone of strong bones. It helps incorporate calcium into bones, increasing bone mineral density and reducing the risk of fractures. It also plays a key role in activating vitamin D, helping to enhance calcium absorption from the gut. On top of that, it has anti-inflammatory properties, which can help protect your bones from the harmful effects of chronic inflammation linked to bone loss. Experts say that adults should consume between 310 to 420 milligrams of magnesium per day, depending on age and gender. Foods that are rich in magnesium include almonds, spinach, cashews, peanuts, black beans, and avocados. For example, almonds, when roasted, provide 80 milligrams of magnesium per ounce, while roasted cashews offer 72 milligrams in the same serving size. Flax seeds, in their whole form, contain 40 milligrams of magnesium per tablespoon, while chia seeds provide 111 milligrams per ounce. Pumpkin seeds, when hulled and roasted, offer a substantial 150 milligrams of magnesium per ounce. You can also consider having black beans, edamame, lima beans, spinach, Swiss chard, bananas, and avocados for a healthy dose of magnesium and other bone-friendly nutrients. Number 4. Phosphorus. This mineral is almost as important as calcium itself. And you might be surprised to know that around 85% of the body's phosphorus is stored in bones and teeth. Both calcium and phosphorus work together to form the foundation of hydroxyapatite, the mineral that gives bones their strength and rigidity. Phosphorus also promotes the crystallization of calcium into hydroxyapatite, ensuring proper integration of calcium into bone tissue. This process directly impacts bone density and strength. But remember that phosphorus needs to be properly balanced with calcium for optimum bone health. While adequate phosphorus is vital for bone health, excessive intake can have negative results. High phosphorus intake can hinder calcium absorption, actually leading to decreased bone density and increased risk of fractures. This is often a concern with processed foods that contain high amounts of phosphates as additives. The recommended daily intake for phosphorus for adults is 700 milligrams per day. Organ meats, especially beef liver meat, provide about 370 milligrams of phosphorus per 100 gram serving. The same serving size of wild-caught salmon offers about 240 milligrams, whole eggs offer about 190 milligrams, and pumpkin seeds offer about 300 milligrams of phosphorus. Aim for a balanced diet rich in these foods, and avoid processed foods with added phosphates, especially processed meats like sausages, hot dogs, and salami, in addition to cola and soda drinks. Phosphoric acid, a common phosphate additive, often adds a tangy flavor and preserves fizz in these drinks, but can seriously damage your bones and teeth. Consult your doctor if you have concerns about your phosphorus intake or are at risk for bone loss. They may recommend blood tests to monitor your levels and provide personalized advice on optimizing your phosphorus intake for healthy bones. Number 5. Boron. Boron enhances the absorption and metabolism of calcium, magnesium, and phosphorus, the key minerals that build and maintain bones. Studies show that boron supplementation can decrease calcium excretion in urine, potentially increasing bone density. Boron has also been shown to enhance the production and activity of sex hormones like estrogen and testosterone, which affect bone maintenance. Adequate levels of these hormones can help prevent bone loss, especially in postmenopausal women. The recommended daily intake for boron is not yet established, but most estimates suggest aiming for 1 to 3 milligrams per day. Some natural sources of boron are prunes, raisins, apples, bananas, avocados, broccoli, and Brussels sprouts. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.